Hi, and welcome to Connecting Citizens to Science. We're passionate about understanding how people and communities can take leadership with health systems. Today we have a special guest.
My name is Sassy Molyneux, and I'm a researcher. I'm based in Oxford now, but I've lived for most of my life in Africa. For 27 years, I was lucky enough to work in Kenya at the Kenyan Medical Research Institute Wellcome Trust Programme. I was actually brought up from when I was 3 to 13 in Malawi.
Thank you, Sassy. To begin, I want to ask you, what do you think about communities' engagement and how can this process can strengthen health systems?
I think that health systems have a huge amount to learn from communities. I mean, health systems are supposed to have people at their center, not just the people who provide the services, but the people who they're serving. There's a huge amount to learn from communities in order to make sure that they are delivering the kinds of care that are needed and helpful for communities. It's very hard for communities to be properly heard by people in systems who are often struggling at the front line. Health workers are often struggling themselves with not having enough resources, with having a lot of pressure, with not necessarily having power themselves in institutions, in health systems. I think people high up in health systems are often trying to work with many different stakeholders and to satisfy many different needs. It's not easy in that complexity for communities to have their voice heard and to be taken seriously. I think there are many structures and systems that try to do that, and many surveys to learn about community views, many committees that are designed to make sure that community members have their voices heard in systems. But the power relations are such that it can be challenging to make them meaningful.
Thanks for sharing. And I have just participated in this discussion in today's Congress. And I understand that you have this decolonized approach. In which way do you think that colonization can be also a topic to discuss in community engagement processes?
I'm part of a decolonization exchange, partly because I want to learn about what decolonization means and what my responsibility is as a researcher based in now, Northern institution with a lot of power. In terms of community engagement, I think that when working with communities, if we don't pay attention to the historical processes that have led to the current situation, if we don't pay attention to how power deeply affects at all levels how relationships work, we risk perpetuating a system that doesn't necessarily serve patients and publics. I think we have a responsibility to try to really think through how we can transform power relations at all levels, whatever our different positions are, to try to open up the spaces for more genuine ability to listen to people's priorities and needs.
Thank you so much. Do you have any extra reflection that you want to share about this community engagement process, or what's the future of research conducting participatory processes and also in the colonialistic perspective?
I think we need to know that we all have responsibilities in our different roles and to think through how we can enact those responsibilities depending on where we're sitting, where we have a power to make a difference, to always be bearing in mind the end goal, which is that we're trying to make sure that people, especially those who haven't historically had a voice, have a voice, and that systems and structures serve them rather than serve the needs of an or distant group, whether that's within the country, within a county, or globally.
Thank you so much, Sassy.